Hey everybody, it's Jessica DaMassa with What's the Future Health. We are talking to the who's who of health tech and healthcare innovation. And today, joining me to announce the launch of a brand new product, I have Dr. Dana Udall, the Chief Clinical Officer at Ginger, and along with her, Dr. Dina Scott. She is the Adolescent Services Coordinator at Ginger, and they are here to announce Ginger for Teens. So ladies, thank you so much for joining me.
Thanks for having us.
I am really excited to talk to you about this, and there is a lot to unpack here. So Ginger for Teens, basically we are taking everything great about on-demand mental health service company Ginger and rolling it out to a population of mental health patients that's aged 13 to 17. So all of the self-guided content, the behavioral health coaching, the video therapy, the psychiatric services, all angled toward that teen market. And what I want to talk about in this conversation, I want to hear about the product updates and all of that stuff in this new launch. But I really want to start with unpacking this teen mental health crisis, because I feel like, especially as we head up to, back to school and things like that, I feel like this has become more and more a topic of conversation. So Dr. Dana, if you could, why don't you kick us off? Talk to us about just how much of a crisis this teen mental health crisis is.
Absolutely. Well, teens have been an underserved population for a long time. So we know that in many counties, I think 70% of counties, for example, there's not one psychiatrist for teenagers. So adolescent or child psychiatrist. So there's a huge gap there in that supply demand. But over the pandemic, mental health needs have really exacerbated. So I have a teen and a tween, and I see this firsthand. So it's been really challenging. It's the isolation, the monotony of day-to-day life, the lack of structure that comes with getting up and going to school. Those things have really impacted teens. And we're seeing things like increases in anxiety and depression. We're also seeing increases in emergency room visits, which suggests that folks are at an acute stage of need. And rather than being able to go and meet with a mental health professional, teens and even elementary school students are going to the hospital to get their needs met. So this is absolutely a crisis. There are not enough providers, not enough specialized folks who deal with teens. So we're super excited to be able to launch this and really make sure that teens get the service they need, no matter where they live.
I want to come back to that supply and demand issue, because Ginger famously always talking about that as a result of having your services being fully digital. But before I do, Dina, can you talk to me a little bit more about some of the other issues that are kind of coming up with teens right now in particular?
Yeah. So just, kind of extending on what Dana shared when thinking about, teens and thinking about just teens being diagnosed with mental health conditions, we have 1 in 5 teens that has a diagnosable mental health condition. And yet we have about 70% of those teens that don't have actual access to mental health providers, which is really problematic. And I think about what Dana was sharing in terms of the pandemic, and I think about an article that was written in 2016, which was years ago, from Time magazine, talking about, the kids are not all right, and just talking about anxiety and depression and the heightened need for mental health spaces. And so to me, you think about all of that, 5 years ago, and then you think about the pandemic occurring and the isolation occurring, and how now we have this compounding effect, and the fact that mental health services are needed that much more for teenagers, for children, and also for families, as you pointed out, Jessica, because you can't really think about a teen in isolation, We need to think about a teen connected to a system and a variety of systems as well.
Yeah, and I want to get into that, and specifically maybe some advice for some parents who might be watching this, or even to their employers who might be, considering bringing in some of these services and offering them to their employees for their covered dependents. But before we do that, I do want to hear a little bit about like the teen population as mental health patients, because it's like, I feel like, teens are difficult, right? Like they're just hard. Like it's such a difficult, I shouldn't say difficult, but transitory time in your life. I mean, things are changing. Your body's changing. You're forming who you are in your head. You're forming who you are as a person. Who you are, in terms of like how you fit into your community, into your family, with your friend group. So, I mean, give me a little bit of insight about like some of the things that maybe make it difficult for teens to even recognize that they need mental health care. I mean, Dana, I don't know if you could talk to that for a minute.
Absolutely. So I think it depends on the teens. I think in some families, there's more discussion of mental health. There's more awareness of these issues. But for many teens, there really isn't. So they may notice that they feel a little off, or they may feel like, I don't want to go out or see friends, or I'm having trouble sleeping, or my appetite's going away. They may not even relate it to a mental health concern. So for many teens, I think they're very much on their own, and they may feel out of sorts or notice that there's changes going on, but not know that they need help or not know how to access help. Stigma is another thing that Dina and I talk about all the time, that there is a lot of stigma for kiddos when it comes to talking about health. And I think for this generation, there's more comfort than in previous generations. I think teens are more likely to say, I'm feeling anxious or depressed, but there's still a lot of pressure to appear cool and in control and as though you have your life together. And most teens don't have their lives together. They're doing the best that they can with the circumstances. So I think when you think of all of those developmental changes going on and that stigma, it really makes it challenging to say, I need help and I know where to go to get it.
Dina, what would you add to that? In the pre-interview, we were talking a little bit about even some of the issues that teens have around sexuality and maybe race. So like, talk to me about that side of it.
Well, and I also want to just, identify when I think about, being a teenager, or I think about, us talking about teenagers, sometimes we think about it in terms of the bad, but I also look at it as like beautifully complicated, right? Because there's so much complexity there and so much connected to identity formation. So Jessica, when you talk about, things such as sexuality, or even thinking about racial identity, or just who am I, right? Who am I in connection with, the world, right? There's so much that's going on internally, externally, and it's a complicated world around us, right? When we think about, all that, might be layered in terms of, discrimination, or we think of different stressors that certain groups, especially marginalized groups in our countries, face as well. There are so many different complex things that are going on, but yet such beauty in being able to be a teenager and figure out who you are, right? But it gets complicated, right? Because if you think again about access and you think about, certain populations, the access gets more limited as we think about marginalized groups. So when you think about, our BIPOC teens, especially teens in lower SES, when you think about our LGBTQ plus teens that might feel like they are not able to maybe fully engage in their identity when it comes to their family or their closed systems, there's so much feelings of isolation that can also occur, or feelings of rejection that could occur, and also questioning in terms of, am I okay? And who I think I am, is that something that should be presented to the world? And then you add on top of that, this being the digital kind of generation, right? To where when you think about, the use of phones or technology, it's so much different than when I was a teen, right? It is a different layer of also kind of formulating who you are and who you are in connection to this world. So the stressors become heightened in different ways. And you think about things such as just trying to access college, right? And what does that mean for teenagers now versus again 20 plus years ago when I was trying to access, college. So the stressors again are just compounding. And so you think about then what anxiety, what depression, what isolation, what all of these things look like when you're also having to navigate all of these environmental stressors as well.
So the need is very much there. I think we're on board with that. So what do we do? And I love, Dina, this whole idea of like beautifully complicated, because I feel like that's so kind. Like, I don't know if you talk to my parents about teenage Jessica, beautifully complicated would have been exactly the phrase that would have come to mind. It would have been more like hell on wheels, or like, I'm just a little bit more, edge to it. But so speaking of those parents, like, let's talk about them for a second. And this might be a good time to talk about, with Ginger for Teens and this rollout. It's going out through employers to their employees. So then an employee would have their teenage dependent who that they would be able to then, bring in and offer these services to. How does that work for a parent? Dana, tell us. I mean, you with your tween and your teen, I mean, like, are they going to listen to you? Like, what is and how is Ginger helping make that easier, I guess, for the parent who's got to have that conversation and say, honey, I think you should try this. Or, how do they keep tabs on their kid once their kid is actually using it? And what kind of reporting goes back? So paint us a picture on the parent side of this.
So parents are the ones who sign the kids up initially, but I think that what we're really doing at Ginger is making it incredibly easy. So this is all through the convenience of a smartphone. So somebody can start talking with a behavioral health coach in less than a minute. And so teens are on their phones all the time. They are digital natives, right? So this is a tool that really speaks to them. And so I think for parents, it's really framing it and understanding what your kiddo needs and being able to speak in their language, and whether they're feeling anxious, whether they're having social difficulties, offering it as a form of support that's really meant to be easy and accessible for the teen's life. So we are also creating a lot of content and really thinking about this product, not as though it's just an add-on for teens, but really thinking about it through a teen lens. What does a teen need? How do we message? How do we change the script so that it feels really relatable, really easy to understand, casual and warm, decreasing stigma? Those are a lot of the things that go into the thinking of it. So once the individual is on the platform and using it, then I think the teens have a great experience, and then they continue to use it from there. And Dina, you would probably have more to say about sort of the flow of
I was going to say, as the adolescent services coordinator, I'm pretty sure she's got her finger on the pulse about what those teens want to see in the reinvented version of Ginger suitable for them.
Yeah. So I think that the family component is huge, right? In terms of thinking about the system that we talked about earlier. And I also think about some of my earliest work with functional family therapy and needing to make sure that you're honoring the role of the caregivers and the teen. But then there's also, like we talked about earlier as well, is there's that identity piece to where you do need to make sure the teen feels like they have a space of their own, right? And that they have a space that's honored as their own. So one of the things that we're also valuing is bringing in teen voices to help us to really inform the work that we're going to be doing. So whether that's, thinking about the care for our teens, whether it's thinking about what information teens feel are important for their caregivers to know or to be aware of. And when thinking about that content and the content piece, how are we developing content for teens by teens, right? Because we know that we might think we have the answers as adults, but when it comes to, being a teenager, it's still some years and years removed. So it's really, really important to bring in those teen voices as well when we think about, the content and the trainings, right? So myself as a mental health professional, I'm always learning, right? So how do I learn not only for myself being a psychologist, but also from teenagers who can help to inform how I'm engaging the teen and their families?
Can you say a little bit more about that? Maybe give us a little color on the some of the input that you guys have received from teens about the new offering. Because I know you guys have a teen advisory council that's helping you kind of repurpose what you've got specifically for that population. So, and I mean, I don't know. Yeah. 16-year-old Jessica, she knew everything. So tell me how they've been helping make this product better and more relevant to people in their own age group.
Yeah, so that is just a great, just kind of indicator of, I think, Ginger's commitment to this work. So we were able to build a teen advisory council, which is 14 teenagers that are between the ages of 13 to 19 years old. They're diverse backgrounds, from a variety of different races, from different states, different genders, different sexual orientations, and they're helping to look at our actual products, in addition to look at our content, our roadmap, and provide us direct, honest feedback. And one thing that I can say that teens are really good at is honest feedback, right? So not really holding back. In addition, they will be having the opportunity to build out some of that content that I alluded to before, to where that's them being able to make specific videos, to write specific things that are for teens by teens that will also be part of our app as well.
That's very cool. I love that. And now, Dana, I want to ask you talk a little bit more, I guess, about the marketability of this, the business side of this for me, if you can, because I mean, you guys, Ginger, you've had a tremendous year. I think a lot of companies that are in this digital mental health space have really, grown and seen actually, a validation of their business models of being digital mental health as opposed to traditional mental health. So talk to me, I guess, a little bit about that here, in particular with this teen population. It's like, how does digital behavioral health win out over the traditional offerings that are out there, specifically when it comes to providing mental health for teens?
Mm-hmm. So it's something that we think a lot about. There is a huge value proposition for parents who, in our model, they don't have to drive across town. They don't have to sit in a crowded waiting room. They don't have to sort through a whole list of providers only to call and realize that nobody has availability. So this really is going to impact the whole family and really make it easier. We know that parents are impacted. In fact, over the pandemic, 63% of parents have had to reduce their workload because of having to take care of their family and attend to mental health needs in their family. So that's pretty significant. We know that employers are very interested because they want to support their employees and their dependents. So this is really a win-win. We're rolling this out with select clients in the next couple of weeks, and it will be available to all Ginger employer clients by the end of this year. We are then going to be rolling it out into all of our healthcare partnerships as well. So super exciting that we'll be able to.
Partnership in there, the Stigma.
What's that?
that Stigma partnership that we reported on a few months ago.
That's a biggie. Yeah. And so these partnerships will really enable us to reach so many teens. And I think that's what's so exciting. I think when I was at Ginger, I think in my first month or two, I remember having the conversation, can we do teens? How would we do this? And it is so complex because each state has its own set of laws that apply to whether teens can consent for care on their own, how involved parents need to be. So it has been a very long process with a lot of legal review, and Dina's been very involved in creating all of these workflows for safety and risk management. But the good news is we're going to be able to support folks all across the country in very underserved areas. So we couldn't be more excited about that.
Can I ask you guys real quick about that, about the state regulations and oversight on that? Is there any move to perhaps eliminate that? I know that in other telehealth type businesses, there's a lot of lobbying that's being had right now to actually remove, like to try to work around some of the state licensures and things like that, because those had been lifted during the pandemic. And so is there a similar thing happening in the mental health space, particularly when it comes with kids, or are we not there yet?
I would say that it's still a little bit more layered and complicated, Jessica, because you have the side of just providing the mental health, but also the reporting laws. When you think about child abuse reporting, when you think about, consenting to services for a variety of different reasons. So there's so many different, I think, nuances to just dealing with minors that definitely is always, I think, being looked at, but gets complicated when you are trying to kind of get everything or everyone aligned in 50 states. So I would say it's always a conversation, but I feel like I haven't seen, and maybe Dana, you feel different, I haven't seen as much great progress as I would think over even the past several decades. And so I'm hoping that eventually there'll be more that feels like there's continuity when it comes to us as a country and how we see our teens, how we see our families in a variety of systems, because it can get problematic as well.
No, fair enough. And I think I'm asking because I'm trying to understand the issue and maybe bring some visibility to it, because I know especially recently, there's been a lot of conversation about some of the state licensures. And when it comes to an issue of access to care, particularly when there is such a supply and demand imbalance, it's just, I don't know, it's one of those things where it's just like, can we not maybe rethink this a little bit, make sure everybody's safe and everything is followed to the T, but just, in terms of providing the care where it's needed, when it's needed, in a reasonable time frame. All right, so this is rolling out, is what we're saying. It's rolling out in August, Ginger for Teens, to all of the employer clients that you guys have. 640 employer clients now. I can't believe that. I mean, Dana, you and I have talked for years now. And so it's like, it's exciting to see you guys grow. And Dina, it's a pleasure to meet you as well. Congratulations on helping pull this new offering together. We're excited to see it go out to those employer clients and then to those health plan clients that you got out there and the rest of the business. We'll have to check in with you and see how things are going. But ladies, I definitely appreciate you stopping by and talking us through, some of the issues that are facing these teens and the work that Ginger is doing to help, them and their parents, work through some of those issues and lead healthier, happier lives. So thank you so much for joining me.
Thanks so much for having us.
Yeah, thank you.
All right, everybody, that's Dr. Dana Udall. She is the Chief Clinical Officer at Ginger, and joining her and me today is Dr. Dina Scott. She's the Adolescent Services Coordinator, also at Ginger. Thank you so much for joining us. I'm Jessica DaMassa. To check out more interviews with the who's who of health tech as they are changing the way that we do healthcare, please check out my YouTube channel. That is youtube.com/WTF Health. We'll talk to you guys real soon. Thank you again, doctors. Pleasure to speak with you.